Hi, my name's Bill Richards. I'm one of the physical therapy assistants here at OSC's physical therapy department, and this is Jamil. He's one of the exercise technicians we have that works here in the building. We're also like a team. So if you're coming here, usually you're going to see two people advancing on you and kind of working with you. The main reason I want to talk about today is the fear of just physical therapy. Generally, everybody knows somebody, a cousin, an uncle, family member that's had physical therapy, whether it's due to an injury, a weekend warrior with either sports or yard care, or have had surgery. And usually everybody's probably heard somebody say some horror stories about us, and I'm just trying to squelch those fears and realize there really isn't anything to be fearful of. Everything is done progressively as far as the program goes for you. So it's anything really you're going to be hit with doing jumping jacks if you got a knee problem, or playing racquetball if you're a shoulder patient. It's nothing like that. But one thing I want to show you, a couple things I want to show you, is some of the tools that we use in physical therapy. So this is just your average lacrosse ball that maybe nieces and nephews or your children play with for high school or college. And we use it as a way of doing some deep tissue work. So Jamil's going to turn around. So what we're going to do, I'm just going to show you, let's say if it's a lower back problem that you have. So we're going to have maybe place it here, and he's going to have his back against the wall, and he's going to be kind of massaging it. So why don't you go ahead and do that for me if you would. So basically we're kind of working over the sore type muscles. Now the amount of pressure or the discomfort you feel is going to depend on how much pressure you put on it yourself. So we're not telling you should be crying when you're doing this, but you should feel a little bit of discomfort. Just like going to a massage therapist and you're getting a deep tissue massage to help loosen up those muscles. So that's one of the tools that we use here just for back pain. So this is what we call a body blade. So usually patients, when it gets a certain stage of the therapy, we may have them on this tool, which we act as an oscillating weight, I guess you can call it that. So this weighs about 3 pounds, and if you have some strength deficits, or you just don't have the strength or too much pain to actually lift the weight up over your head or move it, we can have them do this exercise here, and Jamil will demonstrate that. Just kind of maybe go side to side.
15 seconds.
So you can see basically what he's doing is just trying to get this thing to oscillate. So all these muscles in the front here, the shoulder and the back, are also trying to contract to get this thing moving. So you can see there's really not a lot of arm movement here. It's just a small motion. So you're not doing big wavy action where it might bother your shoulder or cause some increase in pain. So that's another tool you may see that if you have a shoulder problem, you may do when you're here. So Jamil's also, what he's demonstrating now is an exercise like what we call a passive range of motion exercise. So we're using the strap to basically get the knee to bend. So you're not actively bending this knee using your own muscles. He's going to be using his hands to help kind of make it slide towards him. Let's do about 5 times. So when you're doing this, usually you've had maybe a knee injury. It could also entail maybe a knee surgery. So he's basically, let's say you're the patient and it hurts as you bring it back, we'll say stop when it starts to bother you. So maybe you're right there. So I'm not going to force you to drive that knee as far back as you can, especially if you just had an injury or surgery. So it's all within your pain tolerance. So a lot of things we do, you can go back out, that we're doing here is we're not forcing you. It's not like a personal trainer or we're trying to make you gut it out and do each exercise so you're in a lot of pain. Basically, we're doing it to just instill or improve your range of motion, strength, or stability of that joint or that body part. So anytime that you're here, when you're coming through our clinic and you're going through your program, if you're hurting, you have to let us know, and that's why we have a team. So Jamil will be listening to my patient, make him go through the exercise program. He may say, "God, it really hurts to do this." And he'll just tell the patient that just don't try to go into the pain or past the pain, just go up to it. So there's a difference between going through it and just trying to gut it out, and then also just doing to where you're kind of tapping into that limited range of motion, whether it's your knee or shoulder exercise or back exercise. All the principles remain the same. So it's within what you can tolerate in your comfort, and as you get better and improve and pain decreases, then you'll see exercises being a little more challenging for you. So the goal is not necessarily trying to ream you the first day you're here, but also encourage you so you'll come back. what you can do, obviously, if you're referred from one of our doctors or any doctor, and you come over here and you set up appointments, if you want to check out our clinic, you can just say, I'd like to take a tour of the clinic, and we're more than happy to kind of bring you back here and walk you around all the equipment so you know kind of what you're seeing, so it doesn't seem too intimidating. This is not a Planet Fitness, your neighborhood gym. This is just a physical therapy clinic, and just like the name implies, we're using exercises and body movement to improve whatever your situation is. So hopefully this kind of helped you out, and it took the fear of God out of you of what we're doing here, and I just hope you have a good day. Thank you.